Growing up, I was a sick kid and always at a pharmacy, but I really liked what the pharmacist did. I liked how our pharmacist interacted with patients and took time to really explain what was going on and what their medication would do to help them. I knew I wanted to be a pediatric pharmacist from the first time I shadowed a pharmacist in the inpatient setting. I worked in a community pharmacist, an independent pharmacy, during college. I went into pharmacy school knowing I would always be a pediatric pharmacist, and when I left, I went straight into a pediatric residency. Finishing my residency, looking at careers at that point to start, I knew I'd moved to Alabama to be with my boyfriend, fiance at that point, and the only pediatric pharmacy job was with Auburn. I absolutely loved teaching, loved being a professor. My philosophy of teaching has been to try to bring our healthcare setting and environment into the classroom. With me and in being a pediatric pharmacist, I believe trying to learn about our infants and children early is key. So I've even been known to bring an infant into the classroom so that our students could listen through their stethoscopes to their heart rates and breathing sounds. Today, it's a little bit more challenging to do that, but yet I've brought simulation in so many students can listen to different sounds in the lung and the heart. I believe in truly bringing in patient cases, examples of what I have seen in clinical practice, and for them to be able to see it's not a black and white case. They're all different aspects and confounders that can impact the decision you make in their patient care. And trying to remember that we do education to improve patient care. One of my favorite activities being a faculty member is just spending time with our students, from helping them maybe with an educational topic to advising or mentoring. I absolutely love just sitting down and talking with our students to help them find their own pathway, find their own passion. Helping them develop and create goals, not that you tell them what to do, but help be a sounding board, help keep them on a path or show them the variety of paths they can take in pharmacy, whatever their passion is, to learn how to embrace their interest and needs and improve patient care. It means the world to me. So at Auburn, we talk about the Auburn family. Well, we in pharmacy say we have the Auburn Pharmily. And that truly is what it is. Our faculty, staff, and students are just an amazing group of people to work with. I'm Lea Eiland, Hillcrest Clinical Professor in the Department of Pharmacy Practice at the Harrison College of Pharmacy. I am the recipient of the Gerald and Emily Leischuck Endowed Presidential Award for Excellence in Teaching.